Well, we live in a city where the diabetic population is growing, but luckily, the San Antonio Vascular and Endovascular Clinic, also known as SAVE, provides the necessary medical treatment. And here to tell us more is board-certified vascular and endovascular surgeon, Dr. Lisa Ochoa. Good morning.
Good morning.
The noises you're hearing are going to make sense in just a second, I promise. But let's talk a little bit about diabetes. I know that is such a big problem for us here in San Antonio. How is it impacting us and the people here in your perspective?
So as a vascular surgeon, I kind of see all the complications of diabetes. Yeah. And so those are what we know about: diabetic amputations, heart attack, stroke, people on dialysis. Okay. And the area of town that I serve, diabetes is the largest contributing factor to these complications.
And the map that we're looking at right now, this is from the Express News, but kind of explain what's going on here.
So if you look at the dark blue areas, these are the areas of the zip codes in San Antonio that have the highest incidence of diabetic amputation rates. Right. As you can see, it differs from the north side, but even in Texas, there are significantly higher diabetic amputation rates on the south side of San Antonio, or all of San Antonio, when compared to Texas.
Got it. So what can we do about this problem? Does it really come down to being proactive and just getting checked more often?
So it comes down to, one, taking care of your health, and you've heard this from every doctor. Healthy diet and exercise are very important. But once you have the risk factors, you have diabetes, high blood pressure, high cholesterol, or you smoke, then you know that you're at risk for bad circulation to your feet, and you do need to be checked.
Okay, now let's explain what we have going on over here. Our lovely producer, Michelle, has volunteered as tribute. No, what is she having done here? Explain to us what's happening, Doc.
So Michelle is having a screening test called an ankle brachial index, and it's a very simple, painless procedure where you take a blood pressure in the arm and compare it to the blood pressure in the leg. So they should be equal. So that ratio should be around 1. If 1 and 1 is normal.
Okay. We're going to see if you're normal, Michelle. Now, this is something obviously you do for your patients to check blood flow, and this is just another way that hopefully they could prevent an amputation.
Well, correct. Knowing that you have peripheral arterial disease early is the most important thing. So if you have those risk factors, diabetes, high blood pressure, high cholesterol, or you smoke, you should be screened. And this screening test tells you, do I need to get further testing or go to a specialist like a vascular surgeon to see what your circulation looks like? Okay. We have a lot of patients also who may have some of these risk factors, may have a small cut or wound in their foot, and they just dismiss it. I tell those patients, you have to act now. You need to go to your primary care doctor and be screened for peripheral arterial disease.
Okay, and you have an amputation prevention program.
So we have started an amputation prevention program at one of the hospitals on the south side of San Antonio at Mission Trail Baptist, and we're starting another one at Southwest General.
Okay.
And so what this is we take a group of doctors, which is your wound care doctor, your vascular surgeon, and your podiatrist. And any patient that presents to the hospital with an ulcer that is high risk for amputation gets coordinated multidisciplinary care to to get them healed and prevent them from having an amputation.
Oh, what a wonderful service that you offer. That's wonderful. Now, Michelle, you don't feel anything, right? I know you don't have a mic on, but it's totally painless. Are you relaxed? You could be checking your social media right now, just chilling, checking emails. So this is just a program that you offer, and you have many opportunities for people to take part in the program. I guess the best thing to do would be give you a call, right, or go to your website.
So for the month of September, which is PAD Awareness Month, the SAVE Clinic is offering free screenings to any patient at all our clinics. If you call our number, we can schedule you and screen you for peripheral arterial disease. So
how's she looking over there? Way to go, Michelle. And thanks for volunteering, because I didn't get a pedicure and I really didn't want my feet exposed like that. I'm going to be perfectly honest with you guys. But thank you so much, Doc, for being here, and thank you for volunteering, Michelle. And for more information, you can go to the SAVE Clinic. So you can call them 210-610-SAVE, or go online to thesaveclinic.com. You can find out more information on that amputation prevention program. Thank y'all very much. All right, guys, and stick around, because today we asked you on social media about your dreams. We wanted to know what is the most memorable or odd dream that you've ever had. And coming up next, we're going to head to the Daytime Kitchen. Hope you're hungry. It's Taco Tuesday. JD's Chili Parlor is here. We're going to get our taco fix after the break. Wake up, Michelle.
The Daytime at 9 Kitchen is furnished by Clear Choice Remodeling.
Get excited, everyone, because tacos are falling from the sky.
Yeah.
I
How
love
cool
this.
is that?
It's so cute. It's Taco Tuesday, and we have the lovely Diana Anderson with JD's Chili Parlor here to celebrate with us. Good morning. Thanks
good
for coming
morning.
in. I know
Thank
it's pretty
you.
rainy out there.
That's okay. It's great to be here.
I feel like we should send all of our guests, like give them all some money or something
Yeah,
today.
some swag. Here's 10 bucks for
At
gas.
least a T-shirt for making it in. Well, what you got for us this morning?
So today, it's Taco Tuesday, so I thought I would have you guys make our chorizo and egg tacos.
Okay.
I've already kind of fried up our chorizo just to kind of let that already be happening, and we're using Peaceful Pork. Pork from Peaceful Pork Ranch, which is a
Okay.
great ranch. So if you guys just want to stir up some eggs, I don't know what your favorite taco is, but
Fine. Do
chorizo
you
and egg
wanna
is
do
one
it?
of mine. So
Okay.
you guys stir those eggs up here. And then with chorizo, I like mine
Fancy.
I like it pretty
go.
crispy.
I'll let you have some of that too.
So get that.
You like yours pretty crispy?
I like mine
Okay.
kind of crispy, so I don't want it too, the grease, I kind of like the grease to already cook out of
Yeah.
it. So get that stirred up really good,
you
and
doing
y'all
there?
want to
I'm
pour
good.
that in here.
You did all the work already.
I was like, Mark,
You did it good. I was like, man, there's nothing there.
you said that.
So those are farm fresh eggs, and it's really important for us to use sustainable food. So
Okay.
we know our ranchers, and we love to use things that are local. So we're using farm fresh eggs here, which is just going to make this chorizo and egg way better. And the big thing about this chorizo is that we made our own chorizo.
Okay.
You
So
did?
that's our paste over there.
Ooh, okay,
And
over
we
here.
added our JD's chili paste to it, and then some garlic, some of our special spice blends, marinated overnight. And man, does that start really, really getting to be a good chorizo
Made
after
your own
that.
chorizo. That's cool.
Did.
smells delicious in here.
So that chorizo is working right now. If you guys want to go ahead and work that in, and I'll go ahead
Yeah.
and what we're gonna do is
Go
get
ahead and
some.
work that in.
If you want to come over here, and I'm gonna throw down some tacos since it's Taco Tuesday. There's a corn and flour tortilla, and also just a flour tortilla. I like both.
Okay.
And they come in different sizes, and everybody has their own. What's your preference? So you like kind of a bigger one?
I don't
medium-sized
discriminate.
one?
He likes all tacos are created equal.
So I like them the same way. It depends on whether or
Yeah.
not I'm super hungry. So we kind of have some that are a little smaller, some that are a little bigger. For the chorizo, I like a